Welcome, doctors. I'm excited today to have as my special guest, owner of Erchonia, Steve Shanks, and he's the main researcher as well. He's the genius behind all these products here. And today I'm going to ask him some of your more technical questions that come up when I'm doing webinars, when we're doing live seminars, that I think there's a lot of confusion that's out there right now in the laser world. And there's a lot of intentional misdirection too from some companies. So I want to get down to Steve he's just an amazing researcher. The mind that he has for lasers is just, anytime I have questions, I go directly to him. So I want to start by asking him some of the common questions I see from doctors that are out there. And a really common one that I see is doctors will ask, why is it that Erchonia uses the lower power when it seems like everything is trying to say that higher power is better? So Steve, if you can answer that question, that'd be great. Like, why are we sticking with the lower milliwatts versus the high power?
So we use lower power because it's been proven lower power over time is better than a higher dose in just one dose. So there's recently a physics article that was published on the retina and vision. So it said it can see 6,000 photons, but it only uses 700. So for instance, when you shine light on your skin, most of it is bouncing off your skin, which means it's not being absorbed. How do we know that? Because we can see it.
Right.
So what we're looking for is more energetic photons. So what you're seeing with us is we keep going to shorter and shorter wavelengths, and we don't use infrared wavelengths. That's because to create a photochemical reaction in a cell, you need above 1.7 electron volts.
Right.
That's right at the beginning of red light. So even at 635, we're at about 1.95 electron volts. So we're trying to create a photochemical reaction. If I turn up the power, all I'm doing is throwing more photons. If my body can't use all those photons, I'm just wasting power and I'm wasting energy.
Gotcha.
And then I'm overstimulating the cells, and the body's going to send up a defense mechanism, which is kind of the process is why these class 4 infrared lasers heat the skin. So you're sending a bunch of non-energetic photons that are basically absorbed by the water. The water molecules vibrate and it starts creating heat.
Gotcha. As you talk about the electron volts, I think that's something that a lot of doctors just don't know anything about. They know about wattage, and so if you can explain that, because this is when I'm talking to doctors about the difference between, say, the violet wavelength laser versus a green or red, an infrared and a far infrared. What are those electron volts, and why is that important to know, and how does that affect what's going to happen in the tissues?
Okay, take for instance a violet laser.
Yeah.
One photon has 3.01 electron volts. Mm-hmm. If you go to green, it has 2.33 electron volts, which means there's 30% more energy in a violet laser photon than there is a green. If I go to red, it's 1.95. So there's 35% more energy in a violet than a red. Now understand, as you're looking at research, you'll see different photochemical reactions. For instance, if I want a mitochondria stimulation, I'm going to use green.
Right.
If I want to look at fibrosis, mitochondria is red. If I look at fibrosis, it's going to be green. If I want to look at reducing apoptosis, it's going to be violet. Why? One of the studies we did at the University of Illinois is we looked at a dead kidney inside of an animal. Mm-hmm. So we used a shorter, more energetic wavelength so it could penetrate deeper to regenerate those dead cells in the kidney. Mm-hmm. So what we're doing is counterintuitive. We're using energy and not energy in shorter wavelengths, not longer wavelengths and more power. Right. And as you know, all class 4 lasers are approved for topical heating. More power does not mean better penetration. If that was the case, we'd all be treating with YAG lasers on the skin with 5 watts, which we know is going to start, destroying tissue.
Right. Right. No, it makes total sense on there. And so when we're looking at the violet wavelength, let's look at that one specifically. Since that has that higher energy per photon, there's a particular laser, the Avant is going to come out with one that's got 300 milliwatts. That they try to say, oh, well, it's 60 times the power of the Erchonia laser. So it's going to be, you can do treatments in 1/60th of the time. So if you can explain to these doctors, like how is that not even based in anything with physics or anything with research? And what are the potential dangers of using this for sure on the head, but also in other parts of the body?
So Avant is a flashlight. Mm-hmm. A laser is collected and it comes out in a spot. Mm-hmm. From there, we have patents on either line generator or handhelds where then we hit the line and it creates a line beam. It's still a
Right.
laser.
Right.
If I take the focusing lens off of it, I now have non-coherent light.
Right.
As you know, cells speak in laser coherent like fashion.
Mm-hmm.
So basic with the Avant laser, I would never use 300 milliwatts violet laser on anybody. If I
Right.
took 100 milliwatt laser, which we've done before, with a spot, I'll start burning skin
Right.
because it's highly energetic.
Right.
So what we're using is less energetic because the body can only absorb more photons. I can start throwing all these photons at the body. If it's not absorbing it, what good is it?
Right.
The first, law of photochemistry is that for that photon, it has to be absorbed to create a photochemical effect. And you only get photochemical effects with visible light. Does that kind of answer your question?
Yeah, that does definitely. And what is, let's say if you are trying to push, because like the higher dosage to, and what's the hormetic threshold on, say, a violet laser? Like what's the time that you would use it to where it could become inflammatory at that type of a dose? Let's say at 300 milliwatts, how quickly would that happen to where you become problematic?
If you're doing 300 milliwatts, 300 milliwatts, within 3 seconds, you're going to put out a joule.
Yeah.
In, 10 seconds after that, you're going to put out 3 seconds would be 1 joule. So if you wanted 10 joules, 30 seconds after that, you're going to get to bioinhibition.
Yeah.
I would never treat anybody with 300 milliwatt laser. There's no need for it.
Yeah, because then you're going to get into that too high of a dose on it. Because there's some people too that will try to say, like some of the high powered devices, they'll try to compare themselves to the Erchonia laser and say, well, we can do this in 1/20th of the time, that we can, with a higher dose, a higher power of wattage, you can put more joules in the shorter time and do the same thing in, say, 1 minute that would take an Erchonia laser 20 minutes to do. Can you explain about that, about how that's not what's really backed up by the research on there, that you can't do a higher dose in a shorter time and get the same thing that's a low dose in a long time?
Right. Biphasic dose response, that's been published for years. He goes into all the science about why power delivered over time is better than one big giant dose of energy. So for instance, our neck and shoulder with the red violet laser, that's FDA cleared for chronic neck and shoulder pain. We did it for 2 minutes. If you're going to say you're going to do it 100 times less, what are you going to do in 2 seconds?
Yeah.
You're going to treat a patient. What's that going to do? And there's a lot of marketing statements. Yeah. Everything you're telling me is a marketing statement.
Exactly.
Everything I'm telling you has been proven through double-blind, randomized, multi-site, placebo-controlled clinical trials and FDA cleared. The Avant laser is not, the red violet laser is not FDA cleared.
Right.
And then, we tell all doctors, if somebody's going to sell you a laser, say, give me your 510K statement. I want to see what the FDA is allowing you to market. Right. Anything outside of that is basically trying to sell a laser based on a theory.
Right. Yeah, exactly. I think there's a key thing there that you say, based on a theory, because there's no research behind it. It might make sense to us mathematically. Oh, wow, you can do the same dosage in a short period of time. One of the analogies I use with doctors is I say, listen, let's say that we're going to go someplace we want to get barbecue. Do I want to get ribs that are slow cooked in a nice slow cooking oven that has a certain amount of energy put in for a long time, or do I want to microwave them? Even though we put in the same dosage of energy, you've got a completely different tissue results, where the slow cooked ribs are nice and tender and juicy. Those microwave ribs with the high power in the short time, they're tough, they're dry. It's a completely different beast with that. But those myths that are out there a lot. I think another one of the myths, let's talk about depth of penetration, because you see this a lot. Doctors get pitched on this. This is the deepest penetrating laser, so this is the best one out there. So let's talk about that. That's out there. What is the importance or non-importance of depth of penetration with what we're trying to do? Is there any particular thing where depth of penetration would matter versus would not matter?
Okay, let me go back to your question. You're talking about dose, and you're talking about so say we're saying 15 milliwatts is our therapeutic dose,
right?
Which we've proven in blind and controlled clinical trials.
Right.
Let's say that's equivalent of 800 milligrams of a therapeutic dose of NSAIDs.
Right.
What's going to happen if I start taking 2, 3, 4, 5, 100 grams of NSAIDs?
Exactly.
I'm going to create more side effects than I'm already creating.
Exactly.
So once you get over 10 joules with energy, you get to bioinhibition. I mean, it doesn't work. With a 10-watt laser, you're going to get that 1 second. So, and we can get on your next question. So depth of penetration. So when you're treating with an infrared laser, they say more power creates depth of penetration. Well, if the number one rule in photochemistry is for that photon to work, it's got to be absorbed. If it's penetrating, it's not being absorbed.
Mm-hmm.
So what we're looking to do is create a more energetic photon that's going to hit the top layers of the cell. If those cells aren't damaged, it's going to let that energy pass on through and keep getting deeper and deeper, like in our rat model, where we regenerated a kidney, which means we're getting inside the body. That longer wavelength worked better than the green or the red. And again, we compared these against placebos.
Yeah.
So for us to get greater penetration, we're going to treat with a more energetic wavelength with less power over time. Instead of one big giant dose that basically the body's going to set up a defense mechanism.
Right. And I think a good way of thinking about it is it's almost like a domino effect. Like you get all this absorption here in the skin, and it's just creating this cascade, this downstream cascade. Because I know there's a particular study that I had a patient who was using the laser on him on the cervical spine. He was scheduled for surgery and had disc herniations there, and I was using the EVRL, the red-violet combo, and the disc ball just disappeared. And so I got really curious about this and dug into the research, and I found a particular study that showed that red, violet, and green were able to stimulate extracellular matrix modifying enzymes. And in the study, it even said, even though it didn't penetrate directly to the level of the disc, it created this photochemical, as you said, photochemical cascade that caused this repair of the annulus fibrosis that you didn't see with these other wavelengths.
Yeah, when we first came out with Zerona was the exact same time Cool Sculpting came out. So we would just get beat up saying, okay, you're lasering waist, hips, and thighs. All you're doing is fat shifting. Basically, you're taking that fat and pushing it to other areas of the body. So we published a study in Lasers in Surgery and Medicine. I think it's probably 2012. We laser waist, hips, and thighs, measure systemic areas like arms, chest, knees, ankles. We get a systemic effect. That's what it proved, because they all shrunk. So you're getting a photochemical systemic effect with visible light. That does not happen with infrared light. Infrared light, it's there to basically heat the skin. If you look at the ocean, our body's 70, 80% water. The top layers of the water absorb all the infrared radiation. That's why we get the ocean's warming. You get 30 feet below, what are you seeing? Green and blue. The red's filtered out, the green's filtered out. I'm sorry, the red and the infrared are filtered out. So my opinion, what we've proven is that we can do, shorter wavelengths over time to affect the entire system.
Yeah, I know. I've seen that with the Zerona as well too, because we will do, like, we're targeting just the midsection. We'll also measure the arms, and we see in patients a drop even the circumference in the arms without the direct, direct application of the laser to that area. And with that, let's talk about this, because there are some companies out there, like I think it's the Contour Light, that's an LED, and they claim to be just as effective as lasers for fat reduction. So let's talk about the comparison on there between using an LED for fat loss and using, like, say, the Emerald or using the Zerona for fat loss.
So LEDs, we've been using them as placebo devices since 1999, and probably 20 double-blind randomized multi-cyclic controlled clinical trials. Now, do the LEDs work? Probably 90% less than a laser. I would love, if LEDs work the same, we'd be manufacturing LEDs. But when I'm getting something in a blinded controlled study through the FDA, I need to make sure it works. From what I've seen with LEDs, whether it's neck, shoulder, low back, plantar fasciitis, toenail fungus, fat with red, fat with green, autism, any of the research that we've done, LEDs just aren't that effective. Now, you could say our placebo effect is a result of the LED, and that may be so. But when we pitched it to the FDA, we said, look, we'll use the exact same color light with the same power as a placebo device.
And I think that's a key point that you said there too, is that you said that if LEDs worked or something else worked, you would make those. And I know you told me that once before when we were discussing, high and low power. You said, look, I'm not married to a particular wavelength or power. We just look at the research, and whatever's the best, that's what you're going to make. It's not like you're going to try to push something that's not effective. Why would you do that? That doesn't make any sense.
We are a research and development company. Our projects are based on other projects that we've done. I tell everybody that if we would have never done, we got FDA cleared for liposuction in 2004. Back then, no one said, well, you know what? That laser's never going to penetrate past the dermis. And then we showed them an abdominal MRI showing we could emulsify fat to 6 centimeters. If we don't do that study, we do not get to Zerona. Zerona does not lead to Emerald. the Emerald study was based off the Zerona study. The Zerona study was red laser. Well, theoretically, if there's 25% more energy in a green laser, then we should be able to create the same effect as a red laser with 25% less time.
Right.
That's Emerald.
Yeah.
That was a patented process based on that theory.
Right. Right. And as you mentioned that too, that you have these studies that actually show, MRI showing what it's doing. Let's talk about that in the brain too, because we'll have some people that that will say, oh, well, your red laser, that's not going to penetrate, or your violet especially is not going to penetrate to affect the brain. So if you can share, a lot of doctors are not aware of the autism study that Erchonia has done. I know there's certain things you can't speak of, but yet, since it's in there for review with the FDA. Right. But if you can speak of some of the things that you're allowed to, what were you able to show that the laser did with these kids with autism?
Again, I go back to photochemistry.
Yeah.
We did QEEG, which is the best way to measure brain activity. With red, with violet, we showed by lasering the outside of the brain, we could affect deep stimulation of the brain. We even lasered the vagal nerve, and we could show the brain lighten up. So, this is the systems that we're looking at going for. We're not just point and shoot. Right. We're doing a current study on tinnitus where we're using double violet lasers, because we tried green, it worked okay. Red did not work at all.
Okay.
That's in clinical trial right now. So as we learn more, we're going towards shorter wavelengths. The problem with shorter wavelengths and with low-level laser therapy, if you want a marking license from the FDA, you need to do a double-blind, randomized, multi-site, placebo-controlled clinical trial. And nobody that I know of that's in the light-based field is doing anything but Erchonia.
Yes. Yeah, I see other companies that will try to claim that our research is theirs. I've seen them even pass it off that, this is the research, and they'll use a completely different wavelength, completely different power, and it's not at all anything that's been done on their particular laser.
Absolutely.
And now, as you mentioned, using the double vine, so for tinnitus and on the head, with our laser, with the EVRL or with the FX405, how long would it take of you applying that to the brain for you to surpass the hermetic threshold?
Okay, so first of all, on our chronic neck and shoulder studies,
yes,
which is FDA cleared, we treat the cerebellum. We treated it for 2 minutes. So I did a little mathematical calculation because I thought you'd ask me this question.
Yes, exactly.
We know biostimulation happens up to 10 joules per cubic centimeter squared. Okay, so if our 405 and 635 nanometers puts out 15 milliwatts, so it's going to take you 11 minutes to reach 10 joules.
Right.
Now, remember, 1 joule is one teeny little spot on my head.
Right.
Okay, so I measured my head, which is 102 joules. And trust me, I got a big head. It would literally take me, 11 minutes, if you spread it over that time.
Because your head circumference is 102 centimeters?
I'm sorry, it's just my forehead. So I just measured my forehead.
102, okay.
So if I spread those joules, which how we look at it, we're looking at joules. We're not looking at joules per cubic centimeter squared, which is why we don't buy into biomodulation. We would have delivered 0.10 joules per cubic centimeter squared at 11 minutes. So if you want to look out, then I did the math further. If I wanted to reach 1 joule on my forehead, I would have to treat for 110 minutes. If I wanted to reach 10 joules, I would have to read 1,110 minutes.
Yeah.
That's stimulation.
Right.
After that, you get bioinhibition. There is no research anywhere that low-level lasers will cause any damage. And again, I go back to the renal study that we did on the kidneys in the mice. Basically, we cut the blood supply off a kidney to a mouse. We killed it. We used a violet laser, and we looked at those apoptosis, or those dead kidney cells that are getting ready to die. And we regenerated them with just violet laser. So how far does it penetrate? Maybe just to the top layer of the skin. How far does it have an effect? Through the entire system. Right.
That's amazing. It's amazing. And with that, I know you said you wanted to move away from the term photobiomodulation. So what's the term that you think it should be used in what we're doing, and why do you not like that term photobiomodulation so much?
Well, they asked us if we would start publishing photobiomodulation when they changed the term in 2000, I think it was 2014, 2015.
Yeah.
At that point, look, we've done dozens of clinical trials with LEDs as placebo devices, which now you're going to consider photobiomodulation. You'll get guys like Michael Hamblin who write lasers and LEDs are the same, but he won't put in tell everybody they had to file an erratum saying basically they work for every LED manufacturing company.
Right.
Infrared lasers are photobiomodulation. Infrared lasers do not work the same as visible lasers.
Right.
One creates photochemistry, one vibrates the cell and is absorbed by water.
Right.
Broadband light is photobiomodulation. So
Right.
why don't we use it? Because in my opinion, it doesn't work. So what it allows all the scientists to do you've been at class for laser site.
Yeah. Right.
They cite research. Whose research do they cite?
Erchonia's.
Or low-level laser research.
Yes,
Because
or low-level
there's no
laser, yeah.
efficacy.
No,
Yeah.
exactly. Yeah, and that's what I try to point out to doctors. Like they'll say, "Oh, well, this has all this research on there." I always tell them, "Listen, before you buy any laser, go in there, look at what are they specifically FDA cleared for. Have they done any particular research on their particular device for their particular parameters of their wavelengths and their wattage, and what is the research they're showing?" And I've seen all the class 4 ones, like you said, they cite studies that will even show that that high dose that they are selling is not effective, and you see this time and time again.
Yeah.
Yeah.
And you're talking about safety.
Yes.
It takes 10 minimum of about 10 to 13 electron volts.
Yeah.
Which is X-ray,
Right.
which is considered ionizing radiation,
Right.
to start creating damage.
Right.
Again, this is non-ionizing radiation. I have a document from the FDA that says they consider these non-significant risk studies.
Right.
So,
Right.
And we don't treat on the brain for hours. We don't turn up the
No.
power
Right.
because you don't need to.
Right.
Because
Exactly.
it's like I mentioned to you with the eye. If my eye sees 6,000 photons, and it's only using 700.
Mhm.
That what I just mentioned to you about all those photons that are getting shot at your skin that the body's not absorbing.
Right.
What am I going to shoot more to make it absorb more? It's only going to
Exactly.
absorb what it needs.
It's got them. It's like trying to put more water into a full glass. In a
That's
sense.
exactly it.
Yeah.
That's exactly it.
Perfect. Okay, Steve, I want to thank you so much for your time. I think the doctors are going to find this really illuminating. Is there anything else you want to say as we wrap up our time here on this one?
No, anything that, just they can contact you, anything I can do to help.
Okay, fantastic. Thank you so much for your time, Steve. And docs, I hope you enjoyed this video. If you have questions, you can send it here into the group. You can also email me at drgear@gmail.com, and I can pass those along to Steve to get your other questions answered. All right, guys, have a great day.